This podcast is for educational purposes, and all questions related to medical care should be directed to your physician or healthcare provider. Since our guests aren't scripted and are free to speak their minds, their views and opinions don't necessarily reflect those of BridgeBio Pharma. Now, we hope you enjoy the podcast.
Hello and welcome to On Rare, a rare disease podcast produced by BridgeBio, a biotech company that works on developing treatments for rare diseases. At On Rare, we explore what it's really like to live with a rare disease. I'm your host, Mandy Rohrig, a member of the Patient Advocacy team, and with me, as always, is the head of Patient Advocacy at BridgeBio, David Rintell. Hi, David.
Hi, Mandy. Great to do another episode of the podcast and really wonderful to interview Alex.
Yeah, we are excited to visit with Alex, whose son, Hudson, or Huddy, lives with hypochondroplasia, a form of dwarfism. Before we speak with Alex, David and I will talk with Tasia Reddy, who is a scientist working on our hypochondroplasia program at BridgeBio.
Tasia, welcome to On Rare, and thank you for taking the time to talk with us today.
Thank you so much. It's a privilege and an honor to be here.
Thank you. So I know a bit about achondroplasia, the most common cause of dwarfism, and I wonder if you could explain to us what hypochondroplasia is.
Sure. Similar to achondroplasia, hypochondroplasia is also a skeletal dysplasia by short stature, mild joint laxity, and most importantly, it's also a mutation in the FGFR3 gene. Where it differs from achondroplasia is that individuals typically present as a little bit taller than those with achondroplasia. Final adult height anywhere between 4'6" to 5'5". The other critical difference, I would say, between the two conditions, individuals living with hypochondroplasia are typically underdiagnosed or get diagnosed much later in life. Whereas in achondroplasia, it's pretty evident, and these kids get diagnosed practically at infancy or even in utero.
Mm-hmm. So I know an achondroplasia can be seen on ultrasound during pregnancy. The long bones are shorter, etc. And is that not the case with hypochondroplasia?
The radiological features are present, but they're not as evident. How the individuals present seems to be milder.
Mm-hmm.
That's not to say it's an indication of any less clinical need.
So not as easy to identify a child with hypochondroplasia as it is a child with achondroplasia. What is that like for children and families if the diagnosis is missed?
These kids go through life without many functional challenges in a lot of cases. It's only when these kids are not meeting the typical developmental milestones, then the pediatrician may suspect short stature condition, especially if disproportion is also seen. Or if there's limitations of elbow extension, broad short hands, or the kids appear stocky in appearance.
Mm-hmm. Tasia, what developmental milestones are not met as children the same age are?
So when you're looking at the growth charts of these kids, they may not be meeting up as what you would expect for kids for that age. But this is also why it's often missed as well, because beyond height, there's very few medical complications that kids with hypochondroplasia present with.
Mm-hmm. I know with achondroplasia, there are some skeletal challenges at times, a problem with the foramen magnum, which is where the neck and head come together, and that creates some medical issues and sometimes needs correction. So is that less likely to occur in hypochondroplasia?
Yeah, that is fair. The narrowing of the foramen magnum, which is the hole at the base of the spine, is less prevalent in hypochondroplasia. However, there is some kids living with hypochondroplasia may also present with a history of seizures. We are hoping with additional study on treatment options, this will also lend itself to more knowledge for the community as a whole.
What is the incidence of hypochondroplasia in comparison to achondroplasia?
Yeah, excellent question. In achondroplasia, there's actually really established literature around 1 in 15,000 to 1 in 40,000 live births. And the Genetics and Rare Disease Information Center claims that it's fewer than 50,000 people in the US. And I say claims because hypochondroplasia is unfortunately not very well studied. And the upper range of hypochondroplasia, these individuals end up being in the 5-4 range, meaning that a lot of people can go undiagnosed. We came across this individual who was 49 years old when she was diagnosed with hypochondroplasia. So it really can be a long time.
Tasha, what is it like in adulthood for people with hypochondroplasia?
I feel the stories that I've heard from listening to the community really seem to revolve around the likes of pain.
So it may be that someone goes to their physician for pain in the bones or the joints, or
Lower back pain is what we have heard.
and then they are finally looked at closely and
Yeah.
signs of skeletal dysplasia, even if milder.
On the
So-
contrasting end of the spectrum, right? We spoke with this parent and this child presented with seizures, which was part of the reason why this parent took the child to the doctors. And this is how the child eventually got diagnosed for hypochondroplasia.
So it's an interesting situation where many people go undiagnosed and the condition itself is not sufficiently studied to fully understand what life is like, which is why it'll be so useful to speak to Alex about her child with hypochondroplasia. Anything else you would like to add, Deja?
Yeah, I think the field is just beginning to take a closer look and put a lot more thought towards the community living with hypochondroplasia. We believe it's a true honor and privilege to be able to do so. There are no approved treatments in the majority of the world. The other key point I would want to make is that it is a condition where the variant fibroblast growth factor receptor 3 gene can present de novo, which means parents of average stature or height can have children with hypochondroplasia. But then once one of the parents has hypochondroplasia, it increases the likelihood of the child also having hypochondroplasia because of autosomal dominant inheritance.
Thank you for mentioning that, Tasha. Are most children who are born with hypochondroplasia, they did not inherit it? Is that the case?
Yeah, our understanding from the literature is hypochondroplasia is an indication of de novo mutations.
Interesting.
Sounds like we could really stand to learn more about everyone affected by hypochondroplasia, but as you say, in particular, those on the upper end, stature-wise, if they're not diagnosed or they're not understood, that we could miss opportunities to be helpful to them.
Yeah.
Well, thank you. This has been a really wonderful introduction to our interview with Alex.
Thank you so much for giving us the opportunity to speak to you.
I have one more question. Tasha, your name is so beautiful. Can you please tell us what it means?
Sure. Teja is short for Tejaswini. I'm South Indian, and it means radiance. And my middle name is Satya, which means truth. So my name is the radiant truth, and I try and stand by it wherever I can.
That's beautiful, Teja, and something for us all to stand by. I'm really so happy to welcome Alex to our podcast. Welcome, Alex.
Thank you for having me.
So tell us where the story begins for you with your son, Hudson.
Sure. It first started during my anatomy scan. We were informed by the ultrasound technician that his arms and his legs were both measuring short and his head was measuring large. So the maternal fetal medicine doctor and the genetic counselors suggested to me and my husband that we could move forward with some genetic testing and get a skeletal dysplasia panel. And that involved amniocentesis, where they stick a large needle in my belly and collect some amniotic fluid. And, you know, I was very pregnant at that time. The thought of sticking a big needle in my belly was terrifying to me, but we decided to move forward with the testing because we thought, if this will change the care that my son and I will get when I give birth, then I'd rather have answers and I'd rather know beforehand. So we did the amniocentesis. And it came back, and we were informed that our son, Hudson, has a form of dwarfism called hypochondroplasia. There's no family history. And when you don't have a family history of a certain condition, you don't expect that a test is actually going to come back with that result. And the first place my mind went was, are people going to be nice to him? And is he going to be bullied? And, is he going to live a normal lifespan?
Yeah.
All these questions were flooding into my head. So I immediately took to Google and started looking things up. It was all just new and scary for both my husband and I. And then he was born. He actually had been breached. So providers did offer to me. They said, well, do you want us to try to do a procedure to try to flip him? And I was like, you know what? Why would I do that? Because I know his head is large, and I thought that maybe the birth would be difficult anyway. So we just decided to go ahead and just do the C-section. And once he was in my arms, I was able to see him for more than just his diagnosis, which is, a difficult thing when you get a diagnosis before your child is born. That's all you know about them. You don't know their sweet face, their sweet little cute little hands holding on to you, all those things that make you bond with your child. You don't see these things and have that bond with them before you get the diagnosis. So having him in my arms was, very reassuring that this is my baby, and he
Hudson
is the way he is, and I love him no matter what. And definitely a change in mindset. All of the fears that I previously had were definitely put at ease when he arrived. But then there were new fears. We learned that he had breathing difficulties. And this was actually when he was 5 days old, and he stopped breathing after I was feeding him. I had him resting on my chest, and he started to feel a little bit cold. And I thought maybe I was having some hot flashes because I had just given birth. There were a lot of hormonal changes going on, and I wasn't feeling quite right anyway. And my husband came down the stairs, and I said, does Hudson, does he look a little blue? And that's when he started to show some major breathing problems. And I had to perform CPR. He came to a full recovery, and he is okay now, but it opened up my eyes to some of the medical challenges that come with hypochondroplasia that I maybe previously wasn't aware of. So it's been quite the journey that we've been navigating. We've learned a lot so far.
Yes, that must have been such a frightening moment to see Hudson's lips go blue, and very quick thinking on your part and that of your husband to revive him.
Thank you. Yeah, I always say that the best gift that you can give to your children is to get certified in CPR and to, know what to do beforehand, because you never know when you're going to have to use it.
Alex, thank you. And you met with healthcare providers and the genetic counselor about the results. And I'm wondering what did they tell you, and what was your reaction?
Yeah, so they described it to me as a mild form of dwarfism. To be honest, I didn't know that there were multiple types of dwarfism. They described that the final height is maybe closer to average stature than some other forms of dwarfism, like achondroplasia. And in a way that put my mind at ease, because I was thinking about how his quality of life would be. And if he ends up having certain proportions of his limbs that are more conducive to doing daily tasks, like going to the bathroom and reaching certain things, that I thought, that's reassuring to me as a parent to hear that his height would maybe be closer to average height than some other forms of dwarfism. But it still felt very unknown to me. I work as a medical writer, and I have a PhD, and I had never heard of hypochondroplasia before. So, for someone with a medical background, I was like, oh, wow, I need to learn about this whole new topic that I had not previously known about. And then I went to do research, and there's really not that much out there about it.
I was going to ask you too, Alex, you decided to pursue the amniocentesis in hopes that it might change how the physicians approached. So how did that change?
Yeah, so it did influence the decision about whether to attempt a vaginal birth or to do a C-section, because I may have been more likely to attempt the procedure where they would try to flip him. But knowing that his head was larger, it made me more likely to say, let's not attempt that procedure to try to flip him, and let's just move forward with scheduling the C-section. And I made sure that I had a doctor doing the C-section that I really trusted and that I knew had experience and was knowledgeable about skeletal dysplasia. And he made sure to deliver in a hospital that had a NICU so that if anything were to go wrong, he would be in the right place where they would be equipped to take care of him. So looking back on it, I'm very, very glad that I decided to move forward with the genetic testing before birth, because for my family, it helped us make those decisions that we needed to make sure that the birth and delivery went as safely as possible.
That's great. That's helpful to understand because oftentimes people don't get the diagnosis until after the child's been born, and oftentimes many months or years after the child's been born. So that's really comforting to hear and set Hudson up for success.
And when you met with the genetic counselor, anything else that you recall that the geneticist told you about hypochondroplasia?
Yeah, so they told me that it is a rare condition, that it's not a common diagnosis. They did also say that his final height would be closer to average stature than certain other types of dwarfism like achondroplasia, and that, many people with hypochondroplasia don't consider themselves disabled and they live very fulfilling and purposeful lives. They can live independently and form valuable and meaningful friendships and be very successful in life. That their lifespan and their intelligence is typically not affected, even though there are some medical complications that come along with hypochondroplasia. It's absolutely manageable with getting the right care from the right providers. It really put my mind at ease to hear that so many people with this condition go on to live purposeful lives. I know everyone is different and everyone handles news differently. Everyone has a different emotional response to hearing that their child has a medical condition. But for me, I accepted the diagnosis within that conversation. And I think it was because the genetic counselor did a very good job leading me throughout, that mindset of understanding what it is, but also understanding that it's going to be okay. It's manageable and it's, it's going to be all right.
I'm really glad to hear this, Alex. I taught in a genetic counseling graduate program in Massachusetts for 16 years. So I feel like the role of the genetic counselors is not very well known and understood unless you've had direct experience, which my wife and I did actually. And they can be so helpful to make very complicated scientific information understandable for parents and to interpret things. And as you point out, there can be many unknowns, but to equip parents to know what to expect and understand. So this is a free advertisement for genetic counselors. And it sounds like the counselor with whom you met did a very good job of preparing you and your husband for Hudson's arrival.
Yeah.
Alex, could you talk a little bit more about his birth, and were there any unique experiences or extra care during his delivery?
Yeah, so I will say that there was a lot more anticipation and anxiety leading up to the birth than if we hadn't received a diagnosis beforehand. I went in for the C-section and I was shaking like a leaf. Those emotions are running so high. You know that you're about to give birth to a child that has a genetic condition. It's scary. Everyone kept reassuring me he's going to be okay. It's going to be all right. It's still just like what's he going to look like? And is he going to be healthy? Is he going to be breathing okay? Is this going to be, a scary situation? I think that there was a lot more anxiety leading up to the birth and during it. But ultimately, it was helpful to know that our case was kind of a high priority at the time. So they had a lot of providers in the room, everyone on standby who might need to step in, which, is another reason why it was good to know beforehand, because we had all the people in place who might need to step in if something were to go awry. Really, nothing was too different besides just delivering in a place that had the NICU and the critical care component just in case, and then having a provider who had experience with skeletal dysplasia. But besides that, on the day of, nothing really was too different besides the anxiety component.
Curious how your husband was responding to all of this. You seem like the information was helpful and comforting to you to help make decisions and to plan. Did your husband feel similarly?
I think he liked having answers as well, but I think it was a little more challenging for him to come to terms with. I will say that he doesn't have a medical background, so it wasn't as easy for him to look at research and look at those medical publications and really try to understand what was going on. Having the medical background kind of helped me understand what was going on better. And I think it took him a little longer to feel at peace with it. The fact that he's a dad and it's our son. And, my husband was kind of the sports guy. And he pictured that he would, have this child who's like super athletic and a larger boy, and that, my child might have some mobility challenges and they might have short stature and not be as fast as children their age. But eventually, once your child gets there and you hold them in your arms, all your worries get put at ease, and that's when he really started to understand, this is my child and I love him the way he is.
Yeah. When Hudson was 5 days old and he had breathing problems, your training in CPR really paid off. And I also wonder what else you've learned about Hudson's breathing and respiratory system and what's come of that in the months since then.
We still haven't really figured out what caused that breathing problem, the breathing episode at 5 days old. So basically the doctors thought that maybe it was caused by reflux and that it was laryngospasm or a closing of his windpipe or airway that was caused by the food coming up from his stomach. So that was the diagnosis that we were given. And I always knew it was related to his hypochondroplasia, but we weren't totally sure what was the mechanism that caused it. That was always scary to me because I always wondered, is it going to happen again? I didn't want to put Hudson in someone else's care. Like I was very hesitant to start him at daycare, even though I was going back to work when he was 3 months old, because I was afraid that he would stop breathing at any moment. What if the providers don't know what to do, or what if they freeze? And so I made sure to check with everyone who was going to be caring with him how recent their CPR refresher was. And I actually asked my parents and my husband's parents to get those dolls that you can practice on to, know exactly what it feels like to deliver CPR to an infant, because it's very different than if you were to deliver CPR to an adult. And, we're talking about using your fingers to deliver the compressions to their chest. I wanted them to be able to be comfortable so that if an emergency situation were to arise, they would know what to do and feel confident. Thankfully, we never ended up having to use CPR or anything similar in the future, which was wonderful. But we did have, at 1 month old, he had a sleep study and they diagnosed him with severe obstructive sleep apnea. And this is when the breathing stops during sleep, and his count, he would stop breathing about 64 times every hour. And so they immediately put him on home oxygen therapy. My first thought was, is he going to be able to go to a typical daycare with this equipment? I work full time and my husband works full time. I love what I do, and it would break my heart to have to give up my career. But we did learn that Hudson was able to go to a typical daycare. All I had to do was train the people who were taking care of him. And I taught them how to use his oxygen equipment. I made them little guides. I wrote down all the instructions. They probably loved it when I handed them 3 pages of written text for them to follow. But, they were really wonderful with working with us and, being able to meet his needs. They were willing to learn and give him the care he needed. But it was definitely a big learning curve with just little things that we had previously thought were easy, like leaving the house with your child. You pack up the diaper bag, you put them in the car seat. And now I had to think about things like, okay, how do I disconnect the oxygen to make sure he's always connected to it at some point, but then put him in the car? And then where do I put the oxygen when we're in the car? Where do I store the tank when we are using the stroller? How do I make sure that I have enough oxygen in the tank for this duration that we're going to be out of the house? And, it just required an extra step of planning with everything we did. And it was a difficult time in our lives because we didn't have as much independence as we used to have. It was just an adjustment for us. But before we knew it, it became our, new normal. And we got used to it and we became professionals at it.
So another thing that was unexpected that you needed to learn a lot about, helps to be a medical writer when you're writing out instructions for the daycare providers. And Hudson needs to be on the oxygen therapy all the time or just when he's sleeping?
So he initially needed to be on the oxygen therapy all the time. And I want to say that it was around 6 months old. They gave him the clear to just use it during sleep.
Oh, wow.
So at that point, we would send the tank to daycare so that he would have it for his nap during the day. Actually, we just got the news about a month ago that he was cleared to come off the oxygen therapy altogether. So yeah, it's great news.
Phew. Congratulations. That's great to hear. And I hope the use of the oxygen made you less fearful about him stopping breathing again.
It did. It also put my mind at ease to know that he was always going to have a pulse oximeter on his foot, to measure his blood oxygen levels. And it would alert us if he were to go into a dangerous level. So that always put my mind at ease, just knowing that we had that extra measure to make sure that, nothing's going wrong.
Yeah. And how's it been since he's been off oxygen? Is it, he seemed to be doing okay?
Yeah. So he's actually been doing pretty well without the oxygen therapy. He actually shares a room with my husband and I. That was just the easiest way for us to make sure that we were with him in case something goes wrong. And he does wake up more than he did before. He wakes up kind of gasping or making like coughing sounds, but then he goes right back to sleep. Overall, he does seem to be getting plenty of rest. So he seems to be doing okay. And we still do have him on the pulse oximeter just to, make sure that nothing's going wrong.
What an important and helpful transition, and hopefully one that will lead to more independence for Hudson and more independence for you and your husband and living life the way you want to live it. So I wonder if you could tell us about Hudson at 20 months. What is he up to? And just love to hear about him.
He is doing absolutely great. If you had told me right after he was born that this is where he would be in 20 months, I probably wouldn't have believed you. He was delayed with his motor development and he was on the oxygen therapy and he had some challenges. Now at 20 months old, he still does have some challenges, but he is like any other toddler, walking around and babbling and just a smiley, happy guy. He loves to read, loves when we read to him, and he likes to read the books to us in his babbling baby voice, of course. He's just such a happy kid, and we adore him. His sister adores him. He's really, really thriving. He's definitely still behind in terms of certain motor development and speech development compared to his peers. He did have a lot of ear infections when he was younger baby, and he had to have tubes in his ears. So his speech is delayed and, due to those hearing problems. But besides those things, he's wonderful. He's doing really great.
So wonderful to hear. Sounds like a lovely, wonderful little boy. How old is your daughter?
She's 4 years old.
So I'm going to guess that she's really enjoying having a little brother around.
Yes, she loves him so much. It's really sweet to see.
I love hearing about Hudson and you and your family. Mandy, Amy, do you have additional questions or thoughts?
I do have a quick question. Sleep apnea, is that part of hypochondroplasia? Is that a common symptom or is it completely unrelated?
It is related to the hypochondroplasia, due to a number of factors, like the way his face bones are shaped. And he's got a narrow airway. That narrow airway in combination with his muscles not being as strong. So they're floppy. And so that, causes the obstructions in his breathing during sleep. And it is very common in children with hypochondroplasia.
Is that also the same then with the ear infections? Are those also common in children with hypochondroplasia?
Yes, those are common in hypochondroplasia. Yes.
Yeah, and I think what you said earlier, Alex, is really important, that the skeletal dysplasia community does not consider skeletal dysplasias to be a disability. But because of skeletal dysplasia, there are some health problems that do occur and need to be addressed. And it seems like that's what's happened with Hudson, and they're being addressed well, and he's progressing really well. And hopefully the health problems will diminish and his growth and development will shoot ahead.
Yeah, we did have to have a lot of monitoring and special care during his first year of life. We had to have MRIs to check for narrowing at the base of the skull. We also had to check for an increased amount of fluid inside the brain. So these are also problems that can happen with hypochondroplasia that can be dangerous if they go undetected. So we did have to have that scan, to make sure he doesn't have that, which he did not. So we're very happy he didn't have to have any treatment for that. He did have some extra fluid in one of the windows of his brain, but it was not anything that the doctor thought needed to be treated. Also, during the first year, he did have reflux. So we needed to make sure to only feed him in small quantities and very frequently. We made sure that his posture was good when we were feeding him, and his head was kept upright. Every time after we fed him, we would have to support him for 20 minutes or so to make sure that he wasn't having the food come up. We also needed to make sure that his back and his head were always supported at all times. And that's because children with hypochondroplasia, their heads are larger and their trunk muscles aren't as strong. So they can't necessarily keep their head supported as much as another child who does not have hypochondroplasia. So their head can flop forward and cause breathing problems. So we always needed to make sure that we supported his head and his neck every time we held him, or just, that it was supported at all times. We couldn't have him in certain bouncers or infant seats that didn't have the support for his head and neck. We also needed to make sure that his back was kept straight and supported at all times. And that's because children with hypochondroplasia can develop something called kyphosis, or a curvature of their upper spine. And we needed to make sure that his back was straight and supported in the seat that he was sitting in. We would put a thick magazine and put it behind his back so that we would, keep his back straight and supported. And at his checkup, when he got a little older, his geneticist said there were no signs of curving of his spine. There's just a lot of extra care things that we needed to do during the first year to just make sure that we were keeping him safe.
A lot to learn and a lot to do. I want to ask what kind of magazine he preferred to have behind him, but I know that's a ridiculous question, but it's where my mind goes to. Cooking better, or fashion, or National Geographic, So it sounds like you really had a lot to pay attention to, and some areas where you really needed to provide extra care around feeding and sitting. But again, those were mostly during his first year and less so now.
Yes. And I will say that the first year was challenging, but after that, and once he started to become more independent, his body became stronger. We didn't have to worry as much about these special care things. And it got a lot more manageable. And we were able to just really enjoy just watching him grow up and become the awesome toddler that he is.
Well, we hope to hear more about Hudson and his many achievements going forward, Alex. He sounds like a lovely little boy, and you and your husband have done such a good job caring for him and making his care kind of part of life and getting through difficult times.
Alex, can you talk a little bit about what you anticipate will be his care needs in the future?
I would say that hypochondroplasia, being a more mild form of dwarfism, it has some interesting implications, because knowing that your child is not going to be as short of stature as some other individuals in the dwarfism community, you wonder, are they going to fit in with the dwarfism community? But then they're not going to be as tall as average stature folks, so they don't quite fit in the average stature community. So you wonder, where are they going to fit in? You just want your child to have their community and their safe space and a place where they feel like they belong. And it's kind of an interesting journey to navigate as a parent, because you wonder, do I want to really get involved in, the dwarfism community, or do I accentuate the other children, without dwarfism? I don't know. I might not be saying this in the best way, but it's just an interesting road to navigate that I'm not sure that I've quite found the answer for. And I think I'll just need to continue to talk with other parents of children with hypochondroplasia, because there are very specific psychosocial considerations. Another thing is that in the clinical setting, hypochondroplasia right now is treated as if it's achondroplasia, because there are no guidelines for clinical care for hypochondroplasia. So it's really hard to know, is he developmentally on track? Because we're comparing his development to a different condition. Not only is it confusing for me as a parent, but it's confusing for his providers at times. And, just recently they developed growth charts that are specific for hypochondroplasia, which is wonderful. And I'm so glad we have those. But a lot of providers haven't been educated that they exist yet. And they haven't been added to the systems in the hospitals and the computers. So they can't easily be pulled up during appointments. So you kind of have to track these things on your own in terms of tracking their growth. You really do have to advocate for your child in the medical setting, because when there's no clear guidelines for their condition, you kind of have to just make sure that everyone is educated about what to do and just advocate for them.
Yeah, that's very important to know. Is there anything else that you would like a parent or a prospective parent to know?
I would say it's important to know that it's going to be okay. If I had known then what I know now, that Hudson is a wonderful toddler who has brought so much joy, I would not have felt the fear and anxiety that I felt when I first learned about his diagnosis. And of course, there was a lot of learning about the medical problems and how to take care of him. It would have been really nice if, when my son was younger, if we just had a one-page printout with just like the main things of like, keep their head straight and supported, keep their back straight and supported, like that type of thing. And so we're making a one-page printout, and just these little things that I was like, these could actually help people like a lot. But we've done it and we're doing it. And I truly think that Hudson is surrounded by so much love and positivity that, if I had known now that this was going to be the case, I wouldn't have felt so scared.
So helpful. And we're so glad to be able to pass your message on to other families who may have an experience like this. So thank you, Alex. It's been so wonderful talking with you today.
Thank you. I've loved talking with all of you.
How great is it to hear how Alex used her experiences to provide information for the broader hypochondroplasia community? It was exciting to hear that.
I agree, Mandy. Throughout our conversation, Alex pointed out how helpful knowledge about Hudson's condition has been to her. It reminds me of the phrase, knowledge is power. And I think in Alex's case, knowledge can be comforting. And going back to when she decided to have an amniocentesis, just to get prepared and to get more information about what her child was going to be like. And then realizing that it would have been so helpful to her to know that she was going to have such a positive experience. Hopefully she will be able to impart knowledge about having a child with hypochondroplasia to other parents who are going through similar experiences.
Mm-hmm. And despite all the information that she was provided and she was given, both during her pregnancy and since Hudson has been born, she saw that he was more than his diagnosis. And while all of this information provided comfort, the greatest comfort was when she was able to hold her son and enjoy watching him grow.
Yeah. You know, the other thing, she has a PhD and is a medical writer and had never heard of hypochondroplasia. And Mandy, I had never heard of hypochondroplasia before either. I'm not a medical writer, but I am involved in rare diseases, and looking at it from the perspective of the experience of parents who are hearing about their child potentially having this condition. No one has heard of it, or very few people, and it's very hard to feel prepared. I think having other parents around to contact would be really helpful.
Yeah, there's definite need for information for parents, information for medical providers, and certainly the broader community, which I think is what Alex is aiming to do.
Her work, whether it be creating like a one-page fact sheet or making connections, would be really helpful. I also just want to highlight something that she talks about early in the interview. When he was only 5 days old, Hudson stopped breathing.
Oh, yes.
In that moment, Alex and her husband learned that children with hypochondroplasia can also have serious health problems, and one of them has to do with respiratory issues. Amazingly, she administered CPR to him at 5 days old, brought him back. He's doing well, but
it's almost like she was learning as she went along, right? Like she was trying to figure out how to best care for Hudson without all of the information. She's incredible.
Yes.
Can you imagine giving your 5-day-old child CPR?
That's so scary. I would have been freaking out.
How terrifying. She truly was learning as she went, but she was also prepared because she was a parent who knew CPR, so putting it into action.
Yeah. We at BridgeBio, and particularly Neil Kumar, CEO, often ask people living with rare conditions, what does the community need and how else can we help the community? And it seems that there's a real opportunity to help build connections between parents of children who have hypochondroplasia. I hope that we can support people like Alex and this kind of effort to help create a network of parents because, as you always say, Mandy, parents are the true experts.
Thank you, David. Thanks again to Alex and Tasia for helping us better understand hypochondroplasia, a condition that is unique to every person. Because clearly we learned during this podcast that not all people with hypochondroplasia have the same medical challenges as Hudson. Like all rare conditions, each experience is different. To learn more about hypochondroplasia, check out some of these organizations that can help you. The Little People of America, the Chandler Project, and Growing Stronger. Outside of the US, visit the website of ALPE and BKMF in Germany. If you like this podcast, please subscribe. Write us if you have comments or questions at onrare@bridgebio.com. Thanks again for being with us today, and I look forward to you joining us for our next conversation on Rare.